Good morning, folks. Gracia, Pierre-Pierre, sports and exercise medicine specialist, aka Black Stallion. So today we're going to talk about an injury to the medial collateral ligament, which is a ligament that's localized to the inner aspect of the knee. The reason we're going to talk about this topic today is because a couple of weeks ago, I saw a patient at my place of employment that injured his knee, and exactly it was that medial collateral ligament that was injured. So we're gonna go over a little overview. We're gonna talk about the collateral ligaments. We're gonna go over the description, the causes of the injury, the symptoms, the doctor's assessment, the treatment, and return to sport. So knee ligament strains or tears are common sports injuries. So the medial collateral ligament, which is at the inside aspect of the knee, and the lateral collateral ligament, which is at the outside aspect of the knee, are very crucial in protecting the knee from unusual movement sideways. And then you also have the cruciate ligaments that are inside the joint. Athletes who participate in sports, in contact sports such as football, soccer, are more likely to injure their collateral ligament. The collateral ligaments, like I said before, are found on the sides of the knee. So the medial collateral ligament is on the inner aspect of the knee, whereas the lateral collateral ligament is on the outer aspect of the knee. They control the sideways motion of the knee and brace it against unusual movements. The medial collateral ligament is in the inside of the knee, and usually it gets hurt whenever an athlete receives a blow to the lateral aspect of the knee or outside aspect of the knee. And then the lateral collateral ligament is in the outside of the knee. In this talk, we will focus on the medial collateral ligament. The knee relies just on these ligaments and surrounding muscles for stability. This is why it is usually injured. Any direct contact to the knee or hard muscle contraction can cause injury to these ligaments. The medial collateral ligament is injured more often than the lateral collateral one. What are the causes of an injury to the collateral ligaments? So injuries to the collateral ligaments are usually caused by a force that pushes the knee sideways, either inward or outward. These injuries are usually contact injuries, but not always. The medial collateral ligament often occur as a result of a direct blow to the outside of the knee, like in soccer, for instance, when a defender tackles a forward. What are the symptoms? So the patient will complain of pain on the inside aspect of the knee. There will be swelling at the place, at the spot of the injury. There will be instability. So oftentimes patient reports that they feel like their knee is giving. There will be an inability to walk on the knee, and also patient will have a hard time bending the knee. What to expect at the doctor's office? So when you're at the doctor's, you will tell the doctor about what's going on. So the doctor will take a history, and then it will perform a comprehensive knee physical exam, and then it will get some imaging like an x-ray. By the way, the doctor doesn't need an x-ray to make the diagnosis, but the x-ray will let him know if there's any fracture involved. What are the treatment of injury to the medial collateral ligament? So there are two types of treatment. You can have a non-surgical treatment and a surgical treatment. So let's talk about the non-surgical treatment first. What do you want to do? There's an acronym, PRICE, where P stands for protection, and you usually use a brace to protect the knee. And usually you wear the brace for 4 to 6 weeks. R stands for rest. If you don't need to be on legs, you need to be lounging around with your feet up. I stands for ice. Well, you need to use ice 3 to 4 times a day for 20 minutes at a time. You want to allow 2 hours between the application of ice, and you do that for the first 48 hours. C stands for compression. You can use an ace bandage to wrap the knee and prevent any further swelling. You want to E stands for elevation. Not just putting your foot on a chair. You want to be reclined and put your foot higher than your heart so that you can facilitate the return of fluid from your heart from your leg to your heart. And then once pain has resolved, you start with physical therapy. If the non-surgical treatment fails, well, you have the option to have surgery for that knee to repair the ligament. Return to sport. Once your range of motion returns and you can walk without a limp, your doctor may allow functional progression. This is a gradual progressive return to sports activities. Here you have it. We talked about an injury to the medial collateral ligament, which is a ligament that is localized to the inner aspect of your knee and prevents the knee from moving sideways. Okay, and we went over the overview. We talked about the collateral ligaments. We went over the description, the causes, symptoms of medial collateral ligament sprain or injury or tear. We went over the doctor's assessment, the treatment, and what is expected in terms of recovery, return to sport. Here you have it. Gracia, Pierre-Pierre, sports and exercise medicine specialist, aka Black Stallion. Please, if you have any questions, address them to my YouTube channel, my IG, or my Facebook at Black Stallion MD. On my YouTube channel, turn on the notification, subscribe, and share it amongst your friends. Please, let's join forces with me and let's get that fitness thing going.